To move the motion.
Thank you, Sir Mark. It's an honour to serve under your chairmanship, and I beg to move that this House has considered World AIDS Day. I'm proud to speak today as someone elected on a manifesto commitment to end new cases of HIV in this country. Indeed, this was a goal that crosses political divides and was a clear commitment of the last government as well. This is an ambitious target that only 20 years ago would have been completely unthinkable, and that has the power to change countless lives. That we're in this position where it's even possible is testament to the long, hard work of thousands of activists and researchers going back over 40 years. All of us are standing here today in an era where HIV is no longer a death sentence, transmissions can be prevented, and people with HIV live long, happy and healthy lives, and we all stand on their shoulders.
Does my honourable friend complain?
I will.
I apologise to my honourable friend for giving way so early in the debate, and quite rightly there will be many important policy asks in this debate, but on the point he just raises, can we also take a moment to pay tribute to those grassroots campaigners who've been part of the history of the fight against HIV and AIDS. I'm hugely privileged to have Martin Butler, the co-founder of the Terence Higgins Trust, as a constituent of mine, who used his own home phone line as a first helpline phrase, and he quite rightly does he agree? He quite rightly points out we should pay tribute to those people.
Yeah. Thank you very much. I definitely pay tribute to him, to everyone like him who has tirelessly campaigned for change. HIV is the perfect example of progress being made through the sheer determination of those affected, of the loved ones of those affected by HIV, those they unfortunately left behind. So many tireless campaigners that you and I have had the pleasure to meet, and there are fantastic organisations like THT. Before entering Parliament, I worked for the National AIDS Trust, another one of those fantastic sector organisations, campaigning to end the transmission, end new transmissions of HIV, to improve the lives of those already living with HIV. This also included working on a campaign for equal fertility rights for people living with HIV. And I was delighted to see this year the law finally changed just last month to allow equal access to fertility treatment. This is a life-changing development, and there are people I've met during the course of that campaign who can now have a family because of that change. It's not often you can say that children will be born because of a statutory instrument, but in this case, it is true. And I'd like to thank particularly the Minister who's here today for his swift leadership and action on this issue, and every single person who campaigned to make this possible. Thank you. The first project I worked on while at National AIDS Trust was a collaboration with the Elton John AIDS Foundation, the Terence Higgins Trust, who've been mentioned already, and that was the Independent HIV Commission. It heard from experts, those with lived experience, it toured the country to look at good practice, and its recommendations laid out a framework of how we end new HIV cases in England by 2030, how we turn that goal into reality. And one of those commissioners, those independent commissioners, was the then little-known backbench Labour MP, shy and retiring, and now known as a Right Honourable, my friend Res Streeting, who went on to somewhat bigger and better things in the world of healthcare. And a lot has changed since 2021, when the report was launched. But unfortunately, when it comes to progress on ending transmissions, a lot also hasn't. To their credit, the last government should be proud of the investment they made into piloting opt-out HIV and hepatitis testing in emergency departments in London, in Manchester and in Brighton, the one key action that was delivered upon on the last HIV action plan. And that investment has changed many, many lives, including in my own constituency. The implementing of opt-out testing at Hillingdon Hospital has picked up 15 new cases of HIV, 28 of hepatitis C and 140 of hepatitis B. People whose lives have been changed, who now have access to vital treatment. And the story is the same across all the hospitals delivering this amazing programme. This programme is working, but it is currently facing a funding cliff edge. And I welcome the commitment to expand the programme further to other towns and cities, but I do hope the government will commit in future to continuing this pilot where it is already in place and working. Equally, we now know for certain opt-out testing works. We can't find everyone undiagnosed with HIV if we only rely on a system of people thinking they may be at risk, of actively then seeking out a test, of navigating a complex system of overcoming the stigma of HIV to ask for a test. Instead, we must test, test, test. And we need an opt-out testing programme right across the health service and into primary care as well. Unfortunately, the reality is that despite the success of the testing programme, overall progress to ending HIV transmissions has been far too slow. And as recent figures suggest, this year we are potentially moving backwards. Recent data showed an increase in cases. We've seen poor outcomes around late diagnosis, and the disproportionate outcomes for women and for those from Black and Asian backgrounds continue. The gap has not closed.
Would my honourable friend give way?
Gladly.
I thank my honourable friend for giving way, and he is quite right in that there is a disproportionate number of BAME individuals who are becoming infected with HIV. And does my honourable friend think that it's right maybe to raise more awareness of things such as PrEP within those communities who are maybe more disproportionately affected, so that we can too have them in the same position as the majority of the country where we are now seeing infection rates declining?
Thank you. It's a vital point. I thank my honourable friend for that point. HIV is a condition that knows no boundaries. It doesn't affect any one type of person. There's not a community alone that's affected by HIV. It knows no boundaries and it affects everyone. And I think I'll come on to PrEP, which I think is a vital point as well a bit later on. After 14 difficult years of the health service, we are not on track to reach the 2030 goal. At every single stage of the HIV treatment process, we are missing critical opportunities to get people on PrEP, as we've just talked about, to test for HIV and to ensure everyone living with HIV has the support that they need. PrEP, pre-exposure prophylaxis, is, you can see why it's called PrEP for short, is an incredible advancement in HIV prevention. It's a simple daily pill, now in generic form, so incredibly cheap, that prevents HIV completely if taken correctly. And I've spoken before how life-changing this drug is in removing the fear and stigma of HIV. As a gay man growing up in the 90s and noughties myself, the legacy of HIV has always weighed on me, and I'm sure many others like me. Our sense of self, our sexuality, our relationships were always intertwined with the stigma and presence of HIV. Being able to take PrEP is game-changing, and not just for the individual and their well-being, but it's the massive public health benefit that has driven the significant falls in new transmissions, particularly amongst gay men who've largely accessed the drug to date. But it is unacceptable that the drug is not being accessed by everyone who could benefit, that the average wait list for this preventative medicine is 12 weeks, and we know from research that people have acquired HIV while waiting to access this drug. This is a significant failure and something that I hope the new HIV action plan will address. As well as turbocharging access outside of sexual health services, the only place you can currently access it, it is also entirely wrong that NHS silos are holding back access to PrEP in primary care, in pharmacy and other settings. It's also unacceptable that you can't get a HIV and STI postal test in 30% of rural England. It makes no sense that in my borough of Hillingdon, not so rural, but the edge of London, has a completely different postal testing system to the other 30 London boroughs who have their own system. Far too often, as a patient, you're left to navigate complex systems. Of what tests you get will vary depending on where you live, and there are vast ways of this country where there is no option to test at home, while sexual health services are often inaccessible and chronically overwhelmed. Far too often, you have to fight for an appointment, and only those with the sharpest elbows or persistence are getting access to the sexual health services that they need.
On that point,
Gladly.
thank you, John, for making such an eloquent speech. And I think that point that he just made is really, really important, and that actually, particularly for rural and coastal communities, often the testing services and the public health awareness can feel very, very remote. And actually looking at how we use primary care, particularly community hospitals and GP surgeries, will be essential to improving testing and public awareness. So does my honourable friend agree that actually pushing this out into communities is essential to making sure that take-up is just as good in a rural or coastal community as it is in a big town or city?
I thank my honourable friend for his comments. I completely associate myself with them. I think clearly in rural settings particularly, if you have to travel absolute miles to get to your sexual health service, hours sometimes, that's going to put a lot of people, particularly those with the lowest incomes, off travelling to get that test. And they'll just put it off for another day. And unfortunately, we see persistent rates outside of major cities of late diagnosis and of undiagnosed HIV. So I completely agree with his comments. For those who do make it through the complex online systems, the 8 a.m. call queues only on a Thursday, for those who do actively go out and do seek a test, or for those now fortunately being found in our amazing opt-out testing pilot, if they are diagnosed with HIV, they are then not always getting the support they need to access HIV treatment long term. We have some of, if not the best HIV treatment and specialists in the world. HIV is now a treatable long-term health condition. U equals U. Undetectable equals untransmittable. And we need to say that over and over again. This means, in simple terms, when you're on HIV treatment, you cannot pass HIV on. This is a powerful and life-changing thing and message. But despite the advances, 14,000 people living with HIV in England are essentially lost to the health system, diagnosed with HIV, but not being seen by their clinic because of stigma, because of poverty, because of other barriers which are holding them back from getting that life-changing treatment. Badly.
I thank him so much for calling this debate and the powerful speech he's making. Does he agree and share my concerns that the very same communities we need to come forward are not accessing treatment because of that stigma? And organisations like the Fast Track Network, Sophia Forum and One Voices Network are doing fantastic work reaching black women and other BME groups.
Thank you very much. I'd like to thank my honourable friend for that comment and also for your leadership on the HIV APPG, where I know you've been championing this and many other issues. And the recent report, I think, about disproportionality that the One Voice Network, National AIDS Trust had, I think you helped host that important meeting and discussion, looked at this very issue. And, you know, it's true, if you look at the figures, the disproportionality of HIV is stark. We've made so much progress, as I said, whether it's access to PrEP or testing or treatment, but communities are not benefiting in the same way, and particularly Black African and Caribbean communities in the UK, the rates of late diagnosis are far too high, the rates of accessing PrEP are far too low. It is completely unacceptable, and we have to take on that disproportionality, those inequalities, and the stigma that persists that holds people and communities back from accessing those vital measures. They are also, therefore, from a public health perspective, the people not accessing successful treatment, potentially also passing on HIV. And personally, for them, they're at risk of getting seriously ill. Many already are. And the rates not in treatment and not going to their clinic appointments have increased through the COVID period. I hope that the future action plan will fill in the gaps in the last plan. And one major omission was action on this very challenge. And there already are lots of existing examples of really successful local projects that we can learn from, whether amazing outreach services, nurses going out to find patients lost to care. The value of consistent peer support time and time again comes through from people living with HIV. And we must ensure that every HIV team is proactively finding everyone lost to care and supporting them in a holistic way to overcome the barriers to continue with HIV treatment. All of this, it must be said, takes place in the backdrop of a wider crisis in our National Health Service, putting historic strain on health services and affecting health outcomes across the board. Our task is an immense challenge, but it is not insurmountable, because although we are not on track, it is still possible to end this epidemic in this country by 2030. We already have all the tools we need. This week, my old colleagues at the National AIDS Trust released a report with THT and the Elton John AIDS Foundation with some clear recommendations for the new HIV action plan in England. And I'm pleased that the Minister has already engaged with them and welcomed and attended the report launch, which was, I'm sure, much appreciated and shows a clear sign of leadership on this issue. And none of this is rocket science. We're talking about simple, deliverable actions. 1. A nationwide, year-round, online HIV and STI postal testing service, which will be cheaper than the patchwork of services we currently have that vary place to place. 2. Opt-out testing in all emergency departments to be expanded in future to other health settings, like GPs, as has been mentioned, termination of pregnancy services, and elsewhere, so we can really find everyone living undiagnosed with HIV. 3. Broadening access to PrEP beyond sexual health services, starting with a digital service, to ensure those on long-term prescriptions get timely access to the medication, and then to reduce the demand on sexual health services for appointments. And 4, an NHS England programme to find and support everyone already living with HIV back into care with proper care coordination, peer support and appropriately trained staff. None of this is unprecedented. It is happening or being piloted somewhere. We have all the tools that we need. Now we must implement them everywhere consistently. Before I conclude, I'd like to emphasise what an incredible achievement it would be to meet our 2030 goal, the first country in the world to end new HIV cases. Of course, this achievement would occur in a context of a deeply concerning global picture. 1.3 million new cases in 2023, 650,000 deaths from what, as has been said, is now a treatable long-term condition. There is clearly so much more work that needs to be done on the international front too, and international development funding is also vital. Ending new cases in England would also make a remarkable contribution to the global effort to eradicate HIV. We'd provide a replicatable roadmap to prevent transmission elsewhere, learnings that can be exported and shared, simply showing as well that it is possible. Britain has historically been a leader on HIV treatment and on sexual health. Now let's be a world leader on this too. One of the key missions of this government is to rebuild our NHS so that it's there for everyone when they need it. Fixing HIV care and ending new transmissions must be an integral part of that vision. I'm pleased that the Public Health Minister is already working on a new HIV action plan. I've seen firsthand the passion and determination of those working in the sector to make it happen, from campaigners to clinicians to MPs from across the House here today. We now need that same determination from this new government. This government has a unique opportunity, an opportunity to make history, and I hope it will seize it. Thank you.
First of all, can I remind people that they should bob if they wish to be called in the debate. Also, I've noticed 1 or 2 members arrived after this first speech had already been called, so that person won't be allowed to speak. Looking around the room, I think we're going to end up with about 2 minutes each. I'd be grateful if people didn't go on beyond 2 minutes, and if they could desist from interventions, otherwise everybody who wants to speak won't be able to speak. So the question is that this House has considered World AIDS Day. I call Jim Shannon.
Thank you, Sir Mark. That's the second time I've been called first in a debate and within one day, so thank you very much for that. Okay, I think I'll pick the 6th number for Saturday night now on that. Can I just say what a pleasure it is to be here? And first of all, can I commend the Honourable Gentleman for Uxbridge and South Russell for leading the day's debate. He brings knowledge to this here. Every new MP brings their own knowledge and particular interest, and that's Honourable Gentleman. Thank you for sharing that. And it's also good to acknowledge that the issues to help us support and promote positive living for those suffering with HIV/AIDS. There's some 6,008 new HIV diagnoses in England, 51%, really worrying trend. So the question to the Minister, and lovely to see the Minister in his place, it always is, what can be done to reduce that figure, because it's very clear that whether people are being more reluctant to go for tests or whether it's a lifestyle or leading, but there needs to be something done with that. In relation to the government committed to achieving 0 new transmissions of HIV in England by 2030, so if that continues to rise, then the 2030 target will not be met. I want, if I can, Sir Mark, just very quickly refer to Northern Ireland's only HIV charity, Positive Life. They're instrumental in making a difference to the quality of people's lives for over 25 years, beginning life as the AIDS telephone helpline in 1986. They have a range of services now. A city centre facility expands across all of Northern Ireland. In addition, they help to prevent the increase in HIV infection through training, education and raising awareness, to campaign and lobby, all the things they do. And in Northern Ireland, the figures were around about 1,000 in 2016. They're now up to 1,325. But I understand from the figures I'm getting that there is still a need to address that figure, even though that's some 8 years of 325. If you take 8 years, that would be about 30%. The latest figures show that the rate of HIV diagnosis in Northern Ireland is falling, but people of a heterosexual orientation are getting more HIV diagnosis. To conclude, Sir Mark, in relation to the timing, World AIDS Day, let's do more to remember those lost to HIV-related illnesses. Steps have been taken through the government's HIV action plan. So more can be done to end new HIV transmissions in England and indeed across the whole of the United Kingdom. I would ask the Minister, would he commit to ensuring that the devolved nations can play their part in ending new HIV transmission by 2030? I know the Minister is always committed to that, but I just ask him again for the record. Thank you.
Okay, I call Michael Payne.
Thank you, Sir Mark. It's a pleasure to serve under your chairmanship, and I'd like to start by thanking my honourable friend, the member for South Uxbridge and South Ruislip, for securing this debate ahead of World AIDS Day on the 1st of December. With his background as the head of policy for the National AIDS Trust, he brings a wealth of knowledge and expertise to this debate, and in the short time since his election to this House, he is making a powerful difference on this issue. Can I also thank the Public Health Minister for being here and the swift leadership he's shown since the general election too. With 105,000 people across the UK living with HIV and more than 38 million worldwide, it is important that we take this moment to celebrate our successes in fighting this virus, but also recognise the challenge that lays ahead. And it's important to understand, Mr Chair, that constant action is required, or we can and will fall back in our battle against HIV and AIDS. I agreed, Mr Chair, to become the co-chair of the APPG on HIV and AIDS because this is a fight we can and must win. And I'd like at this point to place on record my thanks to my fellow co-chairs on the APPG for HIV and AIDS, Florence Eshilomi, David Mundell and Baroness Barker, for their leadership on this issue. AIDS is no longer, Mr Chair, an unrelenting reality that we have to endure, but a consequence of our collective failure to share the necessary knowledge, protection and medication with everyone who needs it. 38 million people living with AIDS worldwide is therefore a policy failure, not an inevitability. And we can see the impact of sustained intervention over time, Mr Chair. Since 2014 in the UK, there has been a 68% drop in cases amongst gay men, a 12% drop in new cases among black African people, and a 40% increase in those on PrEP since 2021, and a total 36% decrease since the peak in 2014. But we cannot and should not rest easy. The fight against HIV and AIDS is ongoing. There is good news, Mr Chairman, in the data, but there are warnings too. More than 42 million people around the world have died from AIDS-related illnesses since the start of the epidemic. And in 2022, the number of new diagnoses increased for the first time, predominantly driven by an increase in cases among heterosexual women, the highest number of cases, Mr Chair, ever in my constituency of Gedling. We must seek to understand why and to tackle the root causes immediately. Because, Mr Chair, one life affected by HIV and AIDS is one too many. But we should recognise that life with AIDS that people suffered through the 1980s is no longer an inevitability. The fear that came from the unknown can and should be expelled. Treatments have improved and now people can live a long life with an undetectable and untransmittable HIV diagnosis. We reached this point, Mr Chair, and I'll finish on this point, because of the hard work of so many that came before us. I want to pay tribute to Terence Higgins, one of the first people in the UK to die from AIDS. His legacy is the success that we see today. And finally to Sir Elton John, who led the way in breaking the stigma around AIDS, publicly stating that his sex life put him at risk and raising millions for AIDS charities. And to, Mr Chair, finally, the scientists who work to make drugs like PrEP a reality, and the activists, as my honourable friend said, who campaigned to keep AIDS on the agenda through the 80s, 90s and 2000. We stand on their shoulders today, and I hope we can do justice to their legacy.
Yeah.
Can I ask members, please, to try and keep to the 2 minutes if they can? David Mundell.
Thank you, Mr Chairman. So I'll simply agree with what both the previous speakers have said, and I do commend the member for Uxbridge and South Ruislip for securing this debate, but also his work with the National AIDS Trust, and I'd really positively support their report along with the Terence Higgins Trust and Elton John Foundation getting on track, and I was very pleased to see the Minister's engagement with that report already. As a co-chair of the APPG on HIV and AIDS, I'll focus on the global issues, if I may. We've already heard that there were 1.3 million new transmissions last year, and in sub-Saharan Africa, 62% of those infections were amongst women and girls. So I have really three asks from the UK government. One is to continue to be a major contributor to the Global Fund to fight AIDS, tuberculosis and malaria. Since 2002, the UK has committed over £5.4 billion to the fund, making it one of the largest donors, and it's extremely important that it continues to do so. Secondly, the UK needs to focus on expanding access to antiviral therapy, ART, for people living with HIV. ART is a life-saving treatment that not only improves the health and quality of life of individuals, but also reduces the risk of HIV transmission. And thirdly, the UK needs to be a leader in confronting anti-LGBT+ legislation globally. We know the risk of arrest and criminality leads to people to hide their sexuality, avoid testing and eschew treatment because they are evidence of so-called subversive or criminal behaviours. These laws are an impediment to progress and undermine the efforts of the UK to assist health systems, and we must stand up against them, and I hope the Minister will confirm that in his remarks.
I call Bell Ribeiro Addy.
Thank you, Sir Hendrick, and thank you to the member for Uxbridge and South Ruislip for bringing forward this really crucial debate. I want to start by commending the work of campaigners and activists who have worked tirelessly to ensure that we have international awareness on HIV and AIDS. The legacy of racism surrounding the AIDS pandemic casts a long and enduring shadow for communities like mine in Lambeth and indeed across Africa and the Caribbean. And whilst the impact of the virus has evolved, and so too has our understanding of it, the legacy of the racist attitudes around AIDS has had continued consequences for black communities in the healthcare system. HIV-related racism and stigma increases vulnerability to infection in black communities, and those who are HIV positive are less likely to come forward to be tested or access treatment and health services. Last year, more than 1 in 3 HIV diagnoses in Lambeth were classified as late, meaning that the immune system had already suffered damage. And across England, 44% of diagnoses are late, and women are 51% more likely to receive such delayed diagnoses. We all know that early detection saves lives, and offering effective treatment that ensures that those living with HIV can lead long and healthy lives and not passed on the virus once it's suppressed. And those who are not infected are still at high risk because HIV stigma can prevent people from accessing information and education. We also know that cultural taboos linked to sex and sexually transmitted diseases in black communities can also impact on people's access to HIV prevention and education, and thus directly increases the vulnerability to HIV infection of those who are not infected. Racist assumptions around HIV and AIDS have also had consequences in other areas of the healthcare system. As recently as 2021, the NHS had a discriminatory blood donation ban on black donors due to flawed science around HIV. Now, this had a direct impact on sickle cell sufferers, an illness that predominantly impacts the black community, and treatment which is dependent on blood transfusions, particularly from a rare blood group such as the RO group, which is common in black people. The legacy of these rules has resulted in reluctance amongst the black community to come forward and donate blood. And this is why I commend the work done by organisations like the Terence Higgins Trust, who made a concerted effort to combat outdated and discriminatory policies and all the damage that they cause. I couldn't allow this opportunity to pass without mentioning the new Brixton Blood Donation Centre in my constituency in Brixton, which is opening in a few weeks. And I'd like to extend an invitation to the Minister and all members, actually, to come and visit the new clinic and to open their veins and donate. And also, it's so important that we challenge the misgivings around blood donation, so encourage people to donate. Ending HIV, new HIV cases, is not just a medical issue, it's a social justice issue. And we have to challenge the racism and discrimination that prevents individuals from accessing care, education and support. Thank you.
Thank you. I call Tom Hayes.
Thank you, Sir Mark, and it's a pleasure to speak in a debate called by my honourable friend. I wish to speak about the 1980s in Britain to reflect a perspective that may be more common in this place because of the general election. I recently asked the House of Commons Library about the average age of Labour MPs first elected in 2024, and the answer is 43 years. was quite relieved to hear that I was below that.
Are you sure?
Yeah. And for so many of us in this place, the 1980s made who we are. For those of us who are gay, either we or the gay people we knew grew up with the legacy of stigma and a deficit of self-acceptance. But thankfully, where we lacked a political language, there were ways to weave together the grief, the fear, the shame, the anger and the regret that was forced upon gay people by homophobia in some of the state, some of society and some of the tabloid press in the era defined by Margaret Thatcher's premiership. Too often, the response of gay men was to run away, turn away, run away, turn away, because the answers you seek will never be found at home. The love that you need will never be found at home. For many young gay men, they were the small-town boys that Jimmy Somerville sang about. They ran away to places like London, Manchester or Bournemouth, and one man who left for Bournemouth was John Eadie. Until very recently, we've known very little about John, in fact. We know he was gay. We know he ran a guest hotel, which was a haven to meet and drink in the late 70s and early 80s. We know he was charming and friendly. We know he wasn't the kind of guy to throw himself in front of the camera. In fact, he would be the one taking photographs. And we know that it wasn't in a big city, but by the seaside, where John presented doctors with the first signs of a mystery illness in 1981. That he quickly deteriorated and ended up in hospital. That his carers in Bournemouth, baffled, sent him to the Royal Brompton in London, where his immune system was rapidly collapsing. And we know that he died in his 10th hospital day, on October 29th, 1981. His cause of death, at the age of 49, recorded as pneumonia. But John's death is in fact the first recorded AIDS death in Britain. His story has remained a mystery for 40 years, and we only know now because of a research team that involved Paul Brand, Nathan Lee and Mark Jordan, wading through thousands of death records. And I want to thank this remarkable research team and for his support with parts of this speech, Paul Brand. As the Member of Parliament for Bournemouth East, I am honoured to put the name of John Eadie, a former Bournemouth resident, into the official parliamentary record. Yeah. No longer, I hope, will he be known as Patient Zero or the Brompton patient. And as a gay man whose generation was being born as John's was being devastated, I am honoured to remember John and his story and help, alongside others, to contribute to the eradication of the stigma of HIV and AIDS. Because many of those who died of AIDS didn't have children, because their older relatives are dying, before this period passes into the past, we must tell their story. We must hold it here, thank the doctors and nurses and the LGBT community and the allies who went far beyond every call of duty to care, and to honour everyone who suffered and died, anybody who lived in shame and died in secrecy, because no longer will the last record of John Eadie be in the Lancet Medical Journal, where even in this record there was no mention of AIDS as his cause of death, because it hadn't been invented as a term at that point. Known for much of his lifetime as Patient Zero, now I believe we can finally honour the man by his real name. John Eadie, may he rest in peace.
Yeah. I call Steve Race.
Thank you, Mr. Chairman. I want to congratulate and commend my honourable friend, the member for Uxbridge, for securing this debate to mark World AIDS Day. Colleagues are making important points about the huge progress, both medically and socially, that we've made as a nation over recent years. Though, of course, there is always more to do. In 2023, there were 132 people in Exeter who were diagnosed with HIV and accessing HIV care. It's estimated that around 5% of all people living with HIV in England are undiagnosed. So there will inevitably be people in Exeter living undiagnosed today. And I therefore welcome the continued rollout of opt-out testing to identify and support these people. I want to touch briefly on 2 points. First, the international picture. Addressing inequalities in global health requires a country-led approach that puts grassroots communities in the driving seat. It's important, however, that this approach includes an unflinching commitment to defending and extending human rights. The global HIV pandemic has demonstrated the importance of addressing human rights violations as a central tenet of driving down HIV rates. Today, UN AIDS releases its report into human rights and HIV/AIDS. The report, which includes a foreword by Sir Elton John, demonstrates that the world is not on track to end the HIV crisis, and neither is on track to meet the UN's social enablers targets, which aim to reduce the social and legal impediments that limit access to life-saving HIV services. LGBT human rights are increasingly under attack from authoritarian governments and otherwise democratic governments whose elected leaders choose to vilify minority groups for political gain, and that is becoming a central tenet in the playbook of these extremist forces, and that makes it all the more important that the UK government takes a global lead in advocating for human rights if we want to reach our commitments on eradicating HIV transmissions. And just secondly, Mr. Chairman, and very briefly, I want to use this opportunity to thank all the many volunteers and activists across our country and across the world who have worked so hard to get us to the position we are in now, from caring for friends and relatives to protesting to setting up activist organisations. The fight against HIV and AIDS has always been led by committed individuals. And in particular, I want to recognise the work of Nick Perry, a much loved and admired resident of Hackney who sadly and suddenly died recently. Nick was a polymath, an expert amateur historian, a keen advocate for good planning and place, a volunteer for London Pride, and importantly, an HIV education advocate who volunteered with the Terence Higgins Trust. I do recommend to everyone his comedy stand-up segment at Nerd Night London, available on YouTube, that tackles HIV issues and sexual health in a very accessible way. He was incredibly generous with his time and was a great mentor to me and many others, and will be very much missed by everyone he met. My condolences remain with his husband, Andrew Grace. Mr. Chairman, people like Nick and many others in this country around the world will always be the key to our collective ambition to end all new HIV transmissions, and we must do everything we can as a government to support them. Thank you.
Michelle.
Thank you. And thank you for the honourable member for bringing this really important debate here today. Some of the words, in fact all of the words that we've heard today have been quite poignant and very impactful. I wish to speak on the impact of AIDS on women. In the UK, women make up 1/3 of people living with HIV, and just over 1/3 of new HIV diagnoses are in women. In the UK, it is crucial any strategy for AIDS does not forget women and their unique experiences of this disease. Often women with HIV are some of the most disadvantaged members of society. The Terence Higgins Trust have previously estimated that almost half of women living with HIV in the UK live below the poverty line. They also estimate that over half of women living with HIV have also experienced violence because of their HIV status. I spoke earlier today in a debate on tackling violence against women and girls. This is yet another opportunity to highlight the actions we need to be taking to ensure women in the UK do not have to live in fear. I also want to take this opportunity to raise the importance of women getting tested for HIV, as it can often feel like there are too many barriers in place. We have made great strides in the treatment of disease. It is vital that women can also access these treatments. It is also important to raise that often Black, Asian and ethnic minority women face worse outcomes and experiences in our healthcare services than white women. This will no doubt also be seen in how these women access HIV care. I will, however, finish by saying that we must strive that all those living with HIV are able to do so with the freedom from HIV secrecy, to know that they are accepted, that HIV is not a label, free to pursue their dreams, faith and relationships, free from stigma and discrimination. Thank you.
Okay. Can I thank members for their brief contributions and obviously giving time for the front bench speakers. Moving on to the front bench speakers, can I call Helen Morgan?
Thank you very much, Sir Mark. It's a pleasure to speak with you in the chair and indeed to represent Liberal Democrats on behalf of them for World AIDS Day. I must start by thanking the member for Uxbridge and South Ruislip for his excellent introduction to this topic and for bringing the debate about today. And there have been so many brilliant contributions, and I want to leave plenty of time for the other front benchers to speak, so I won't go through them all, but I'm very impressed that in such short time we've covered so much ground and so eloquently. Particularly wanted to pick up on the member for Bournemouth East, who powerfully told us the story of John Easy, and thank him for that contribution. AIDS is one of the globe's biggest killers, as we all know, despite being entirely preventable and treatable. In 2023, nearly 40 million people across the globe were living with HIV, 1.3 of these who became newly infected within that year. And given that it's entirely preventable and treatable, it's something that we can aspire to bring that number right down to zero. In the United Kingdom, the fight has been serious and ongoing since the 1980s. And yet since 2021, the numbers diagnosed have been increasing while the numbers of being tested is decreasing, and we absolutely have to make sure that that is turned around rapidly now. Testing is still 4% lower than pre-COVID levels, and that's been driven by drops in heterosexual men, where the testing rates are 22% lower than the pre-COVID period. The most recent UK-wide estimates estimate that around 5,000 people are undiagnosed and not aware that they're living with HIV in the UK. And again, this importance of testing, and I entirely support the call for opt-out testing, is paramount in order to bring those people into the healthcare that they need and deserve, and to prevent the disease spreading further. Internationally, good progress has been made, but it's still an extremely concerning picture. And I just want to pick up the inequality in that picture. There are 4,000 adolescent girls every week and young women aged between 15 and 24 years becoming infected with HIV globally. And 3,100 of these infections occurred in sub-Saharan Africa in 2023. Poverty and displacement are driving these higher rates of infection, and there is a worrying link between conflict, sexual violence and HIV. And that's something that I think we really need to address. I want to be brief. So to summarise the policy ask, Liberal Democrats are keen to ensure universal access to HIV prevention, such as PrEP and treatment. I've mentioned the importance of opt-out testing. We need still to work to eradicate, to eliminate the stigma and discrimination against linked to HIV, and in particular the racial and racist element that's been so highlighted so carefully earlier on. We'd like to press upon the government the importance of restoring the public health grant, which the Conservatives have cut by a fifth since 2015, to deliver better access to sexual health services. And in terms of helping globally, it's important that we restore, or at least set out the path to restoring, the 0.7% of gross domestic product for international aid, to enable issues like AIDS to be prioritised in accordance with our requirements. And with that, I'll leave it and leave time for the front benches. Thank you.
Okay, thank you. I call Dr. Caroline Jackson.
Johnson.
Oh, Johnson.
That's okay. Thank you, said Mark, and it's a pleasure to serve under your chairmanship. As we mark World AIDS Day, we are called to reflect on the progress that we have made and the challenges that remain and the road ahead in our collective fight against HIV and against the stigma that has so often been associated with it, particularly in the past. The UK has much to be proud of in this effort. Through the introduction of an HIV action plan, we have set ambitious goals, such as an 80% reduction in new HIV infections by 2025. And remarkably, we've achieved the UN AIDS 95-95-95 targets back in 2020. We achieved 95% of individuals living with HIV diagnosed, or presumed to be living with HIV diagnosed, 99% of them on treatment, and 97% achieving good viral suppression. These figures reflect the dedication of our healthcare professionals and the effectiveness of our public health strategies. When diagnosed early, people with HIV in the UK can now expect a relatively normal life expectancy. The disease is no longer the death sentence it once was, and the Honourable Member for Uxbridge and South Africa has spoken about that. Sadly, this is not the case worldwide, and my right honourable friend for Dumfriesshire, Clydesdale and Tweedale highlighted the global picture is quite stark, and last year AIDS-related illnesses claimed as many lives as the sum total of all wars, all homicides and all natural disasters that ravaged our planet. And in parts of South Africa, over one-fifth the adult population, such as in Botswana and Zimbabwe, are living with HIV. And these figures remind us that the global fight against AIDS is far from over. Troublingly, within our own borders, we're starting to witness a reversal of some of the hard-won gains. What was a long and steady decline of HIV rates in the UK has suddenly and sharply risen in recent years. HIV diagnoses in England doubled from roughly 3,000 per year to just over 6,000 between 2020 and 2023, which reversed, unfortunately, more than a decade of progress, and has thrown the government's goal to end HIV transmission by 2030 into some jeopardy. We must focus now on what's driving the resurgence, and one key factor, a worrying trend identified by the World Health Organization, is a decline in condom use, particularly amongst younger populations. Between 2014 and 2022, there was a survey of nearly 250,000 adolescents across Europe, finding that only 61% of sexually active men and 48% of young women were using a condom during their last sexual encounter. The Honourable Member from Uxbridge and South Ruislip has talked about the success of PrEP and the great availability of it, and how it's an important tool in preventing HIV infections, and it's undoubtedly saved lives. The Minister therefore has a complex challenge, how he continues to promote life-saving interventions like PrEP, whilst also reinforcing the importance of safe practices such as the use of condoms. I'm interested in the Minister's plans to achieve that. Another part of the answer is effective testing strategy, and as the Honourable Member for South Uxbridge, quoting more of his speech, said, testing, testing, testing. I know that the Labour Party like to have three of the same words in a row, so that's right. Successive governments have been working very hard to reduce the stigma and normalise HIV testings through campaigns such as the iTest programme, which help to normalise HIV testing as something which is routine, something which is beneficial both for the individual concerned and to the wider society. And these campaigns have largely been targeted at communities with a higher HIV presence. However, there was also the opt-out testing introduced by the Conservative government, which has had a significant impact and is now available in 34 emergency departments across the country. It has identified hundreds of people who had previously been undiagnosed or had been lost to follow-up of treatment with HIV and hepatitis B and C. The identification of these cases helps the individual concerned and also helps to reduce transmission among the wider population. So what plans has the government got to expand the testing into more areas of the country and to A&Es across the country so we can find out what other undiagnosed cases may be out there? Between 2019 and 2021, the estimated number of undiagnosed cases in England declined, but opt-out testing has suggested there are more cases out there than we realised. So has the Minister got plans to re-estimate the number of cases of undiagnosed HIV that may be out there in the community waiting to be treated? When one studies the statistics of new HIV diagnosis, it's also clear that there's been a rise driven more recently by the migration of individuals of HIV who are HIV positive. So I wonder what consideration the Minister has made of giving HIV testing for this population and what plans he has to try and target measures to reducing HIV within that group as well. Finally, I want to talk about education. Education has been and remains a key pillar in protecting young people from HIV and AIDS, and also reducing the stigma associated with the testing and associated with living with HIV. We must recognise the extent to which pandemic disrupted health outreach programmes as well as traditional learning, leaving many young people without access to vital information. It's important young people feel comfortable seeking advice and accessing resources, and it's here I'd like to take a moment to acknowledge the tireless work of organisations like the Terence Higgins Trust and the National AIDS Trust and local sexual health clinics, who've continued to provide life-saving services under incredibly difficult circumstances. However, they cannot tackle this crisis alone, and indeed, currently, with the government's new budget, they're facing high charges from national insurance contributions, with the Terence Higgins Trust employing over 200 people. Does the Minister have, what conversations has he been having with the Treasury about exempting such charities from paying national insurance on their employees so that they can continue their good and life-saving work rather than just paying more tax into this government? We need to ensure they have the funding and resources to expand their outreach, particularly in the underserved and high-risk communities. On this World AIDS Day, let us reaffirm our commitment to ending this epidemic. Let us celebrate the progress that we have made while recognising there is still much work to be done. And let us ensure that future generations can live in a world that's free from the shadow of AIDS.
Thank you. I call on the Minister, Andrew Gwynn.
Thank you very much, Sir Mark, and it's a pleasure to serve under your chairmanship. Firstly, may I say that I am extremely honoured to have this opportunity to come before the House today to speak at the first dedicated debate on HIV and AIDS in this Parliament. And I'm incredibly grateful to my honourable friend, the member for Uxbridge and South Ruislip, for securing the debate on a topic that is not only so close to both of our hearts, but to the heart of this government. Because we are a government that is committed to ending new HIV transmissions in England by 2030. And with World AIDS Day fast approaching on the 1st of December, this debate is a welcome opportunity to highlight the importance of our new HIV action plan, which we are aiming to publish in summer next year. Achieving this goal demands collaboration, and that is why dialogue and engagement with every part of the system will be crucial as we progress with the development of the new plan. I am delighted to have the continued support from colleagues across the House, and like many already, want to commend the engagement of fantastic charities and organisations such as the Terence Higgins Trust, the National AIDS Trust and the Elton John AIDS Foundation, amongst many others. Sir Mark, I want to pay a tribute to all members that have contributed in this debate, the Honourable Member for Strangford, and I want to assure him that as Public Health Minister in England, I will be liaising closely with my counterparts in Northern Ireland, in Scotland and in Wales to ensure that we are all on track to end new cases of HIV in our respective jurisdictions. My honourable friend, the member for Gedling, who speaks so powerfully on these issues, the right honourable gentleman, the member for Dumfriesshire, Clydesdale and Tweeddale, who, along with my honourable friend, the member for Exeter, raised the issues of global inequality and of stigma and of pervasive legislation that still exists in far too many parts of this world. And I want to assure both members and the whole House that this new government will continue to be a major contributor of the Global Fund. Our obligations on the international stage are clear. We're not just about tackling HIV in this country, but across the globe. And when it comes to human rights and anti-LGBTQ+ legislation, this government and this country will always stand for equality, for human rights and for justice across the world as well as at home. My honourable friend, the member for Clapham and Brixton Hill, spoke about issues within black and minority ethnic communities specifically, but also I'd love to come and visit her new clinic, so consider it a date. My honourable friend, the member for Bournemouth East, in such a lovely and loving contribution, I want to thank him on behalf of the British government for putting the name John Eadie on the record. No longer a statistic, a human being who happened to die of AIDS. And we pay tribute to John and to those that died after him for being ahead of all the drugs and treatments and advances in technology that we now have. Their death was not something that has been in vain, because through them we remember them and the sacrifices of their friends and families to support them in really difficult times so that we have a better world ahead of us today. And my honourable friend, the member for Sherwood Forest, and indeed the honourable lady, the member for Shropshire North that leads for the Liberal Democrats. And I want to assure her that this government is committed to public health and prevention. And whilst I can't circumnavigate the budget process, we will do all we can to restore that public health grant over this Parliament and into the future, because public health and prevention matters and it is a priority for all of us. Sir Mark, just this Monday I had the pleasure of attending the launch of the voluntary and community sector report jointly by Terence Higgins Trust, National AIDS Trust and Elton John AIDS Foundation, where I offered my reflections on the valuable recommendations presented to us. I welcome the report along with its recommendations, and I look forward to developing the HIV action plan alongside such a vital sector, because we remain committed to hearing from those whose frontline expertise, grassroots connections and powerful voices will ensure our plan is not only ambitious, it is grounded in the lived experiences of those it seeks to support. Now, let me be clear. Getting to zero means smashing stigma. World AIDS Day offers a stark reminder of how far we have come since the 1980s, and this year's theme of stigma throws into sharp relief how far we have yet to go. It calls on all of us, not just as lawmakers, but as members of our communities, to reflect on the prejudice that people living with HIV have faced, not only with a life-threatening illness, but also with alienation, with misinformation and discrimination. I have been thrilled to see the innovation and effectiveness of stigma reduction strategies across the country. And I am keen to build on that knowledge and work closely with the UK Health Security Agency as they continue to monitor stigma data through the Positive Voices survey report to ensure that addressing stigma is a key priority for our new HIV action plan. Because the experiences of the 1980s should remind all of us that stigma thrives in ignorance and in silence, and that is why we are determined to address this head-on as part of our honouring the legacy and work of so many others that went before us. Now, for the avoidance of doubt, we will not be satisfied until the numbers of transmissions reach 0. Yet there remains differences in the rate of diagnoses between demographics. As the numbers move towards 0, we must work together to reach those communities who have not been captured thus far. That means including and empowering these voices, not essentialising them. It means cultural competence. This means innovation. It means collaboration. And that's why we're hosting engagement sessions and roundtables in parallel with external stakeholders, including people with lived experience, the voluntary and the community sector, professional bodies, local partners and others. We're working alongside UCSA, NHS England and a broad range of system partners to inform the development of the new action plan that will build on the progress made on the existing plan and guarantee that it is robust, inclusive and evidence-based. Central to this effort is the importance of testing, a message we cannot repeat enough, and I apologise to the Shadow Public Health Minister. I'm going to repeat it. Test, test, test. Testing is the gateway to prevention. It's the gateway to treatment and ultimately ending new HIV transmission. We know that HIV opt-out testing works well. During the last 27 months, over 2 million HIV tests have been conducted, and it is able to reach those who do not typically engage with sexual health services. Tomorrow, UCSA will publish their opt-out testing report, providing us with the latest data. This will inform the next steps for the expansion of opt-out testing. We will also use this as a foundation to explore how our action plan can build on these successes. Successes like the National HIV Testing Week. Yet we know that at the lower levels of testing persist amongst Black, African and heterosexual groups. We have seen this trend intersect with women too. This requires tailoring our approach to reach those people living with undiagnosed HIV who have been overlooked. And look, PrEP plays a vital role in the combination approach. Breakthroughs in science and medicine that have meant that with the right treatment, people living with HIV can now lead long, healthy lives. The PrEP roadmap was published by the HIV Action Plan Implementation Steering Group in February this year, identifying barriers to access for underrepresented groups. So this roadmap will guide our efforts to improve access, uptake and the use of PrEP amongst those most at risk of HIV. In closing, Sir Mark, I want to say that we are determined to get to zero HIV transmissions. This World AIDS Day, let us honour those we've lost by recommitting ourselves to a future free from fear, misinformation and discrimination. The Don't Die in Ignorance slogan is sadly as relevant today as it was upon release. Together with science, compassion and unity, we can achieve a future of zero new HIV transmissions and where stigma is consigned to history.
Okay, in the 20 seconds we've got left, I'd leave it to Mr Beales to just say a few words.
Thank you, Mark. I'll be brief because I have to be, but I'll say thank you to the Minister, thank you to everyone for contributing. I think it's clear there's cross-party support for this action, and you'll have our full backing in taking this plan forward. Thank you.
Okay, the question is that this House has considered World AIDS Day. As many as are of that opinion say aye. Aye. To the contrary, no. I think the ayes have it. The ayes have it. Order, order.